our, uh, oh, okay. I guess being recorded, so that's a good thing. Uh, Once again, thank you very much for your time and everything. And what we're going to be doing is we've got a pretty full agenda. We've got a couple speakers, keynote speakers that we're going to share the phone with. So if you would go ahead and I just wanted to start. It looks like we're going to be talking about, benefit costs. We're going to be talking about some of the individual things associated with the COVID-19. We're also going to be talking about not only how we handling is the focus of our last teleconference. We're not only focusing just on how to handle people working from home, how to handle telework, how to handle, layoffs and things like that. But now we're even to a certain extent starting to shift our focus to what do we do, once the state opens up. For example, here in Ohio, May 1st, which is a Friday, so probably more realistically would be May 4th, people are going to start, populating the office once again. And of course, that's, brings with it a unique set of obstacles or situations that we've got to deal with as HR professionals. So with that being said, I wanted to take a moment and introduce our two speakers today. We've got Joe Shunia. Am I pronouncing the name correctly,
You
Joe?
are, thank you, yes.
Okay, good. We have Joe Shunia and Bill Ackman, and they are both with TriNet. And Joe is the Midwest Director for TriNet, and he brings along with him 20 plus years within the human resource or HCM industry. And joining Joe is Bill Ackman, as I just mentioned. He is a professional services consultant at TriNet, and he has 6+ years within the HR HCM industry. So we've got some topics that are going on. And so, Joe and Bill, do you have a listing of the, agenda, which was like beginning with controlling future benefit costs? Do you have that available?
Yes, in an email, yes, I read over it. Mm-hmm.
Okay, so are you ready to go ahead and take the ball and run?
Yeah, sure. Yeah, thank you very much. I really appreciate it. And hello, HR professionals and partners. My name is Joe Shunia. I am the director here for TriNet here in Ohio. And Bill and myself and my team we work with businesses from a sales consulting standpoint to help them with solutions, unique solutions that will help them, especially through times of need like right now and the future. Just some background, our position today is one of advocacy in the sense of we wanted to bring to light some of the information that TriNet Solutions Company has available to help small to medium-sized businesses succeed in varying topics that we have related today for our meeting. And so just to be clear, we are sales consultants that will be relaying information to the team on the phone, and we can help answer any direct HR questions. It can be answered through the resources potentially that we are going to provide. And of course, potentially on the TriNet platform itself. So if you don't know who TriNet is, by the way, we are a 30+-year-old HR solutions company. We were born in California, San Francisco, California. We are national. Today we have about 18,000 small businesses, small and medium-sized businesses that underneath our umbrella, we have 350,000 roughly worksite employees. And if you include dependents, we service also about 500,000 people, including dependents underneath various benefit plans. So that's who we are, and that's some background on some of the consulting expertise we can bring to the table today. So let's start off with some of these topics, and really it'll be covered as I just quickly give. I believe I have about 20 minutes, and I'll just give a quick scenario on the current state and what we're hearing from our clients and what we're hearing from the HR people in the trenches and the C-level executives of the companies that we are engaged with as clients and also as prospects. And one of them, of course, is that first topic of controlling and containing costs with with benefits. As everyone knows, it's typically challenging for a small to medium-sized business to obtain not only quality benefits but affordable benefits for their employees. and then utilize that obviously as a tool to, from an HR standpoint, attract and retain top talent. So SMBs can actually compete, small and medium-sized businesses can compete with some of those Fortune 500 companies that are in the same industry. And what we're seeing and what we've seen, there are some New York Times articles, by the way, and some studies already done by United Healthcare and some other carriers. And their initial projections depict a little bit of a, quite honestly, a potentially gloom future for the rising cost of health benefits due to COVID. What they're expecting is a possible premium increase of potentially 40%. Now, whether that's true or not is yet to be determined, and they admittedly say it's yet to be determined. But one of the things that a lot of SMB leaders don't know and executives may not know is that it's during the summer that a lot of that the majority of the large carriers, and all the carriers really, and their actuaries it's summer when they actually determine what 2021 rates will be looking like. And so there's a lot of legwork that's being done right now. Imagine a 40% increase in healthcare benefits would be extremely detrimental, especially to a small to medium-sized business when they're faced with a potential increase like that. And so there are ways, by the way, three basic ways to really address the potential increase that's going to be coming. At a bare minimum, the increase is expected to be more than normal, but there are three ways. And the unique ways that companies can really look at progressing the increase potentially is, number one is going down the road of instead of a PPO, offer a variety of plans that are more down the road of an HSA-driven high deductible plan that the employees can afford. The other way too is to have different funding strategies within your own company for different levels of people, or different classes, better said. And then also being able to offer a variety of plans that actually could address the census nature and the age nature or the generational nature of the people that work for their companies. And so what a lot of times we're finding is that a lot of employers are either overinsuring or potentially underinsuring their employees based upon the limitation of plans that they offer. And they don't necessarily know that there's a lot of plans out there. Lastly, the big suggestion you can do is to find a way, if an organization can find a way to be, for lack of a better term, lumped into a bigger group for healthcare, and maybe be part of a group that will then allow for more of a stabilization of cost and predictable costs and renewals, that would also help you impact that. There are ways to belong to a bigger group. TriNet, by the way, as a professional employer organization, does offer that opportunity. And when you're part of a bigger group underneath the larger umbrella, that gives scaling power, and then it gives you the capability then to have more of a predictive cost model year over year when these renewals come. Initial strategies that companies deploy and look at from a consultative standpoint, as far as offsetting the potential future cost and still being able to attract and retain top employees that they're either looking to rehire and bring back on board after they lay them off, or hire new people. Okay. One of the topics we wanted to discuss today, and by the way, I can't wait to show you some amazing resources that backs up exactly what I'm saying, and will give you the ability to actually look at things that TriNet is providing from an HR resource standpoint to businesses. And some of these topics will be covered in that. The second topic, real quick, is, of course, as HR professionals, as you know, compliance is a major factor really at every level, state, federal, and local levels. And what we're finding from our clients now is that in really trying to not only evaluate all the legislation that has been passed, but also to decipher what it actually means specifically to their own organization, best deploy all of the intricate and complicated aspects of everything that has been passed recently, and then how thoughtful and legal, for lack of a better term, legal or compliant conversations with and actions with their employees and as an employer. And so they've been deep in legislation trying to figure those out. I think as everybody knows on here, Google HR is probably not a good place to go. Uh, and a lot of the employers we're talking to have more or less a de facto. They unfortunately, you'd be surprised, a lot of the C-level leaders are finding themselves as the de facto HR person, and they're looking for help. And so I'll cover some resources that can help with that. And really the compliance deals with different levels. I'm sure all the HR professionals on the phone know. It's a litany, right? It's the conversations. It even goes to engaging applicants, how to people properly, dealing with EEOC, all the FMLA rules and regulations that were passed, and then not to mention, all the unemployment and things that have changed over the past, or an ability to change over the past few weeks. Okay. The third thing that we're in some resources today too, as an opportunity from a learning standpoint, or different ways to attack it, is during this time, companies are also looking to understand how they can actually deploy through technology, hopefully, and communication, a remote workforce. And this is a time of change for them for that. And technology and also HR, as everybody on the phone I'm sure knows, plays a huge role. In extending your culture, extending your expectations. It's really reiterating job description, really important for businesses in a remote workforce to ensure productivity with their employees. And so technology has never played more of a role in that, not only from like Zoom, but also from an HRIS, a Human Resource Information Services technology platform. And that's where mobile technology and platform technology that's available at the fingertips of employers and employees has never been more critical in this time to properly communicate benefits, benefit administration, HR-related questions and services, and really giving the employees the technology to be able to look at their phones and immediately answer the important HR questions from a data standpoint that they need on a day-to-day basis. Okay? And then lastly, companies are looking to really look at opportunities because they are running leaner right now due to possibly furloughs and the slow of business. They're realizing that they're running leaner with fewer people on staff. And this is the time for them to really operate even more efficiently than they ever have been before. And so they're looking for ways to run more efficiently, but also ways, because they're running leaner, to really control and contain costs around operational costs as businesses. And that goes back to, again, employer and employee related costs. So those are really the four umbrellas that we're finding that companies are really have really had to tackle and deal with the past 4 weeks: running leaner and being more efficient, addressing the culture of benefits, being knee deep in compliance and all the SBA loans, and then lastly, really taking an inward look to see where they can actually reduce some top line costs that will return money back today that they need desperately for cash flow purposes. Okay? Does anybody have any comments or questions, or does anybody have any comments around, is that what they're experiencing in their world right now before I move on to some resources? Okay. So good. Well, I guess I'll share my screen real quick, and I'm going to share some great resources for everybody. Okay, and I will start off with, first and foremost, we will share this with the group on the phone. Trina has created basically a one-stop shop from an information and guidance sheet standpoint on understanding COVID-19 assistant options. I'm not going to go for time for all of this today, but as you can see, this is hopefully going to be extremely helpful for you as HR professionals and for your businesses that you represent. So on the left-hand side over here, you'll see represented the actual deployment of the assistance options that were deployed on the left-hand side all the way down. Okay. Essentially everything that was deployed and you would need to enact and know. And then on going across the top, you'll see what is the assistance option? How do I use it? Do I qualify? How much do I get? Do I need to repay it? How long will it last? And what are the restrictions? Would you find this, for the people on the phone, would you find this useful if we share this with you?
This is Tim. Yes, I would believe 100% this would be very helpful.
Okay, good. So I will distribute this. We'll have this distributed through Holly on the call. I'm sorry, I interrupted somebody. Was there a question there?
There's no question, but well, actually, I do have one. I'm sorry, this is Tim once again. I do have one question.
Yeah.
When you just mentioned a moment ago in regards to potentially, and I heard a couple moans, potentially fully insured platforms looking at possibly, once again, possibly, very strong, possibly maybe up to a 40% increase. And the interesting thing is, I guess I'd like to kind of set the stage here a little bit. We just happen to be self-insured. And what I've seen in the months of February and March, of course, April's not available yet, but February and March, our actual claims are below budget because it's because there's no elective surgeries, there's no a lot of people aren't going into the hospital unless it's COVID-19 related. Pharmaceuticals about on track, a little bit low, but not significant, not like claims. So with that being said, what do you think the insurance companies are basing something like a 40% increase? Is it in months to come? Is it exactly what?
Yeah, so it's displayed in the article, and again, I'm not the benefits expert, but we do a lot of research and we have these resources. But Tim, that's a great question. UHC actually released that they're actually showing a profit this past quarter, and it's exactly because of what you said. Right now, the sky isn't falling yet because they've shut down electives across the country. And so anybody's claims history is going to be lower, much lower than normal right now. But as you can imagine, as these states do open up, and you guys mentioned, the states opening up, one of the things that are going to be happening, that is going to happen, of course, is all those elective surgeries that have been put on hold, and of course, all the ones that have accumulated over this time also, there's going to be a floodgate of that action. So they fully expect claims history to be massive once the floodgates are open. And they're really basing the projection on the fact that they have been, if you see, for example, like Aetna, UHC, Cigna, Humana, Tim, they've decided to eat, for lack of a better term, the cost of hospitalization cost with COVID, which is causing, it's a good faith gesture. But as we both know, even though they're willing to offer that in good faith right now, as you can imagine, they're still running a business. So somehow, some way, they're going to look to recoup the good faith things that they're giving away right now, including co-insurance and co-pays for hospitalization with COVID. And hospital systems, as you can imagine, are struggling right now because those electives are not happening, and also practices. And so that's really, Tim, where they're coming from. The projection is not a definite; it's uncertain. But when you see a lot of news on this, and the news is very similar, the main news is that this year's increases are definitely going to be higher than they normally would be, and then that 40% could be the ceiling. Does that make sense?
Yes. I mean, it makes sense why they would do it, but it's interesting because, they're on TV saying, okay, Aetna, Anthem, Blue Cross, everyone else, they're going to go ahead and they're going to start covering this at 100%. And everyone's like, oh, wow, that's the benevolent thing to do. You guys are great.
Yes.
But behind the scenes, they're thinking like, yeah, well, you don't worry, you'll pay for it next year. And I'm going like, well, wait a minute. What just happened? The bait and switch or whatever you want to call it. So
That's why,
but that's interesting.
Yeah, I really like being self-insured because we have the opportunity to design our plan the way that we think best fits. We have reinsurance, so you stop your losses at a certain point, but you really get to control your costs. And we made the decision that because if you were hospitalized, it'd be like any other accident or surgery or something like that. We did not waive the deductible. Now we reserve the right to change that if we see a whole family impacted, but that's the deductible has limits. And so they would still be okay even in that situation. But I think being self-funded over 100 people is probably something to consider if you aren't already. Because even in a big group setting, I've been part of big group plans before, and you're paying for other people's illnesses at that point. So it's just, you have to assess your current population, and know that that could change, but put your
For
risk
sure.
parameters in place to protect yourself and consider it.
Yeah, and that's a great point. What we're seeing is most of the self-insured policies are for companies that have 100 plus employees. In fact, typically it's usually above 200 is what we're seeing, but it is a phenomenal option. If you look at the population of most SMBs across the country, classified as 12 million, there's a lot of, as you guys can imagine, a lot of businesses under 100 that and again, depending on the industry too, where they're impacted more. So yeah, self-insured is a phenomenal option. And of course, if cross your fingers, if the group is relatively healthy, and there's no like one major, because sometimes one major event can obviously trigger some pretty significant increases if you can control that through the stop losses. But it is definitely, I agree, that is a good option. A lot of companies under 100 have difficulty trying to get into those plans, but I will say underneath TriNet's platform, and I do agree, there are opportunities to go into bigger groups. Where we're a little bit different from a risk profile standpoint is we're very specific on who we invite in our group, and we have a very specific risk profile. And so, underneath our umbrella of 18,000 businesses and 350,000 employees and 500,000 lives underneath our benefit policies, we've done some pretty good. We've been managing our book pretty well, and so our average increase year over year, especially in the professional services industry like yourselves, is roughly about 7% is what we advertise nationally, potentially lower depending on your group. So that's one of the ways we're able to help businesses control and contain costs. But yeah, thank you for sharing. Self-insured is a great option for businesses if they can definitely plan it right. And that's who was that shared with us? That was phenomenal advice.
And my name's April.
Hi, April.
Hi.
Yeah, thank you for sharing that. Okay, so good. So we know this resource you guys will like this resource then. And I'm almost out of time, so I want to make sure I respect time here. I'm also going to share with the group a resource from Fisher Phillips. They're one of the top labor law attorney firms across the country. It's a comprehensive FAQ for employers on the COVID-19 virus. It does start off, by the way, with a little bit slow because it actually explains what COVID is. But as you'll see when we send out this information, this is a great resource to really look at. There's some phenomenal questions dealing with all of these topics in relation to COVID, and it's basically a legal brief and an FAQ for employers around the virus. And because a lot of things have changed in the HR world, especially to labor law because of the virus. So I'm not going to go through all these pages, but if you scroll through, you're going to start seeing, for example, I'm clicking really quick because I want to land on one page because there's some phenomenal scenarios here that are answered for organizations that may not know these questions. Most importantly, what I do like about this resource, and you'll see as you go through it, there are some questions that sometimes HR professionals and employers really tell us that they weren't even thinking about. So this is a nice brief from Fisher Phillips, and it's really 43 pages of Q&A around labor law for COVID. Would that help?
Yes.
Okay, good.
Yes, thank you.
Okay, yeah. So I'll share that with you. I shared this already. And then one of the last two things I'm going to show you real quick is we, as HR professionals, they really like really good, thoughtful, and addressable and relevant white papers. TriNet created, and again, this is not for sales, this is literally for your purposes for education. We created a really great white paper on 8 critical areas all business leaders should consider when it comes to compliance, like a compliance survival guide. And you guys will appreciate this as HR professionals. It talks about end-to-end compliance, starting from the time I actually engage an applicant all the way to the point where I exit somebody. So it deals with some great suggestions and topics around compliance with recruiting, interviewing, status and classification, wages, benefits, paid leave, et cetera, et cetera. So it's a really good, thoughtful white paper I wanted to share with you. And then lastly, this is free to everybody on the phone. I wanted to mention lastly that we're going to be sending everybody a link. TriNet has this amazing website accessible for you for free, and it's our Business Resiliency and Preparedness Center. it literally is a one-stop shop for a lot of things, such as information on new legislation for the CARES Act, PP, and more. For example, click on these webcasts. All these webcasts are also not only coming up, we've done several webinars. One we have coming up actually is on bridging the cash flow gap and funding options. That's going to be done tomorrow, so we can share that with you. This is a free webinar. And then we have webinars we've already done on the state of small and medium-sized businesses, navigating small business relief. These are all replays, by the way. You can actually click on these replays and watch now. We've done webinars on the Family First Coronavirus Act from our Senior Vice President and Chief Legal Officer and one of the partners at Fisher Phillips. We've done a guidance for small businesses for COVID. Qualifications for R&D tax credits for companies that, believe it or not, you guys make, some of your organizations may qualify for. So I just wanted to share this with you. These are all free. This is a link you're more happy to have access to. And it goes from thoughtful information to webcasts to some really great unique ideas on how SMBs are impacted and some press releases, okay? One-stop shop for that. So that's it. I know I talked a lot. Great questions. Was this helpful, I hope? And would you like to have these resources?
Yeah, this is Tim. I actually just kind of, the last part you just mentioned was truncated just a touch. So could you finish that last sentence that you just had?
Oh, my only add was I really appreciate everyone's time. I'm hoping this was helpful. And my general question was, are these resources that you would be interested in utilizing and using now and down the road that we can provide to you for free?
Well, yeah, I think it's just as you mentioned. Sorry, this is Tim once again. Just as you mentioned, go ahead and supply that to Holly, because not only just for those individuals that are on the call, but a lot of times people just can't make the call. And so afterwards, they will contact Holly and say, geez, was there any information that was shared? And then she can go ahead and distribute it from there and keep that as a resource. So I guess the short answer is yes, but the longer answer is, yeah, if you just go ahead and share that through Holly, I think that's a very positive motion or effort.
Yeah, absolutely. And again, if you need any help, please, Bill and I are here to help you. TriNet's here to help. We want to be very compassionate. We're here from a business support and advocacy standpoint, and we're more than happy to help any of you guys in your businesses succeed through this time with those 4 things that we talked about. Thank you, everybody. Back to you.
Okay. Well, thank you both very much. So with that, once again, this is Tim. So I'm just going to go ahead and continue through the agenda that we're looking at, and I think we've gotten through 1A. I guess really helping make benefit increases more forecastable. You're right. If we, and that's exactly what April just supported as well. If we, as a small firm, are kind of at the whim of the fully insured, that's tough. It's really tough. Some of our options are really just to go with a higher deductible, hence the high deductible health plan, and allow the employee to go with some sort of a health savings account or health reimbursement account, or something like that. So really we have limited resources, but I think another option too would be, ACEC. They have a pretty good program regarding the health trust that, we might be able to talk about at a future phone call. That might help defer some of the costs or maybe make them a little bit more forecastable because you've got a larger population to spread that risk across. So that might be a future thing. So the next one is freeing up capital to invest in the business, revenue generating or other. Shoot, I wish we could all, generate more revenue, but as far as it goes with the some of the state agencies or some of the offices closing, at least temporarily, probably not going to focus on the revenue generating side of it, but maybe freeing up capital might be something that we can discuss further. One example would be that during this time, because we have to keep, typically if PTO, paid time off, vacation, sick leave, everything, paid time off is what I'll focus on. If you have that and you say that you will pay that out upon termination, then that's an incurred liability, meaning that you have to carry that on the books, all of it, just in case that someone were to leave or a mass exodus were to occur. So sometimes that's a lot of capital that's frozen that you can't use. And I think most of you know this already, but just to bring this up for discussion is during this time, having individuals use PTO. They might not like it because they really can't go anywhere, but I'm just saying that would free up capital to reinvest in the business. or to do something like that. Like, everyone take a little bit of a hit, meaning, everyone take 1 or 2 days of PTO if they have it available, or at least kind of whittle any kind of a bank they have down because, some firms, and I know there's a couple on the call, they just let people accrue. And some individuals, typically a senior person, would in fact use that as almost a secondary retirement fund or some sort of a Christmas bonus at the end of the year, or, hey, if I ever terminate, then I'm going to get this big, huge payout. And I don't think that's the intent of the PTO. It's, so you can relax and rejuvenate and everything else. So I guess with that being said, freeing up capital, one aspect is PTO. And I'm just going to go ahead and open up the phone line to see if anyone else has anything they would like to add to that, or, like a secondary or maybe even support or contradict the PTO aspect. Okay. Okay. All right. We'll look at that a little bit more as far as what are some options regarding freeing up capital. Of course, there's, letting people go, but
I just posted kind of a related question. We don't pay out PTO upon termination unless it's a layoff or a retirement, but for voluntary termination, we do not pay out PTO. I wondered how many employers do that. We changed a couple of years ago after we did a calculation to see how much money we were paying our employees to leave to go to our competitors.
Excellent question. I'll go ahead and jump in there as well. I'll start. We at Prime AE, we pay out, whatever your PTO is upon termination, whether it was a layoff or anything else, or if you're volunteering. But I like what you just said is, if you're going to a competitor or someone else, then, why are we reimbursing you for that? So, so we at Prime, we do not have that same policy. So I guess my short answer is no, and I'll just be quiet now for a second.
This is April. We pay out, but we only pay a maximum of 40 hours. So there's no real reason for people to hoard their PTO. We want them to use it.
Good. And that's good for, what I just wanted to hear, I think with you, Rachel, and you, April, is that does in fact free up capital to be reinvested in the company, because you don't have to carry that large sum as a retained liability on that. So good points. Any other comments on the phone?
I just have a question. This is Stacy. For those companies that are on PTO versus vacation sick banks, have you had any grumblings from your staff in regards to not having specific sick time set away for them to use for being out? I know we have the emergency paid leave, but just in general terms, people who might have spring cold or stuff like that, and they're angry because they're having to use up their PTO.
Okay, this is Tim. I'll jump on real quick. So with that being said, we haven't really heard any grumblings, and I think the reason for it is because a lot of states are forcing our hand and saying, okay, you have PTO, but you also have to actually pay for the sick leave. For example, New York, Massachusetts, Maryland just started that, where we have some offices. Nothing, but it looks like, before the COVID-19 came around, it seemed like that was a growing trend within the states. And once again, I think you see a lot more things happen during an election year. And that might have been part of it, maybe not. I can't speak to that, but I did see a number of states that were jumping on the bandwagon. Washington, D.C. was another one that added it. So it seems like maybe that's one aspect is, you might have some grumblings, but at the end of the day, probably give it a year or two. I think most states are going to enact some sort of a paid sick leave above and beyond what the PTO was, which is an interesting, circle of events. Is, back in the day we had sick leave and you had vacation. Well, we said, okay, let's go ahead and combine these. We're going to have vacation. It's going to be PTO. We're not worried about doctor slips, anything else. It's just paid time off. So we combine the two. Now the states are coming back saying, well, you know what? You really need sick leave. So you're going to have your PTO and sick leave.
Well, I think most of those regs are written their PTO policy gives them the minimum required or beyond, then it's fine. You don't have to separate it out. So it just depends on the state or the locality putting the regulation in place. And, to the original question, I think that, we've had our PTO plan for so long that nobody has grumbled, but I think transitioning from one could be tough. But if you take the sick time and the vacation time and make that similar to what it looks like today, that transition's probably easier, and you'll get more people happy that they can take more vacation time if they're not sick. So it just depends on how you handle it.
Yeah, I appreciate all the comments. We've been contemplating moving over, and there's pros and cons on both sides of it. We had one employee in Northeast Ohio office who tested positive for COVID, and she's used all 80 hours of the emergency paid leave, and then now is depleting her sick leave and moving on to her vacation time because she's still ill. So as people, and especially if this goes on for more months, the 80 hours is just simply not enough. Under the FFRCA, depending on how many people actually end up getting this. So I'm just curious, an application of use, and people might dwindle their PTO time if they do get ill with this at some point. So it's just, I don't know, I was just asking if anybody came across
We've
anything.
had people donating PTO, and so my coordinator and I came up with a way to allocate that, because some people are doing direct donations and others are just like, hey, take 8 hours of my PTO and put it into a pool. So we kind of set up a way to help the people that are in the worst need for it. And COVID is certainly one of those criterias, and we'll keep that up throughout the rest of the year, and then evaluate at that point. That's one way to help.
Yeah, that's actually a great idea.
It is. And let me, this is Tim. Let me go ahead and throw in there, there's really two sides of the same coin. One would be the continuation of benefits, health, welfare, things like that. And the other side is compensation. So do you, in fact, have a short-term disability plan in place, or it's available to employees, whether it's employer or employee paid? Is there any kind of short-term disability available?
For me, with our sick leave serves for that. So we're still segmented out, and they use their sick leave, which they can accrue essentially 90 days worth of it. And then our LTD picks up at 90 days. But if we move to PTO, yes, we would implement an FTD model in there.
Got it. Okay, that makes sense. Yeah. Because once again, that's really that side of it, is you can continue the health benefits as an employer, as a benevolent employer, but then they're looking at, okay, so what do I do for compensation? And that's when, like you said, either your PTO, as you just referred to, or in other cases would be a short-term disability policy, comes into play. So I just wanted to ask. Thanks. All right, good discussions. The next on the list was helping find and keep great people, knowing the impact it will have on the company. I'm reading into the kind of between the lines on this, hoping that we're saying that the impact is going to be very positive if we keep great people. I assume that's how the question is phrased. So with that, it's, once again, we do have the Payroll Protection Act that just came through, and the gentleman before us was referring to that a little bit. Is that's part of it, and that has to do with the CARE Act and everything else. That's one option. That instead of putting someone down to 20 hours or 25 hours, you can keep them at 40. But the key point is you do have to track that, just to make it easy at the end of the year for reporting purposes on that. Helping find and keeping people. I mean, right now, a lot of people are not working. Some people are unemployed. Some people are on reduced hours. And when this starts, getting back to some kind of normalcy, we as employers will be clamoring just like we were just before COVID-19 hit. And that was related to, how do you find additional engineers? How do you find more architects? How do you find CAD operators? How do you find technicians for the field? There's just not enough, it seems like, to go around. So it sounds like that's a pretty good deal, is, what do you do to keep the people happy? And if you can keep them happy on your payroll now, chances are they're not going to look, but they still could. I mean, a lot of times some positions, they're just chasing the dollar, and don't really look too much further than that. It's, who's going to offer me a little bit more, and on the job sites they talk. So I hope I hit what that is helping find and keep great people, knowing the impact it has on the company. The other side is, and I apologize as an HR person, maybe I shouldn't even say this, but on the other side, this is also an opportunity for firms that have maybe been carrying someone for a period of time, thinking that, well, you know what, at least the person, is somewhat billable, or at least the person does, get a job done, and really we can't find a replacement, so we need to keep this person. And so sometimes this is a good opportunity to kind of evaluate who is on, the payroll and who's doing what, and to make sure that people are fully utilized. And you do have the cream of the crop, or the best performers that are on the firm. And like I said, it's kind of probably a not a great conversation to have, but it's one that I think we as HR professionals, hence the human resource, management, comes into play. Is, do we have the best of the best, or is there a couple people? And what I've told other individuals in the past as well is, you could have a team of high performers, but even with that team, there's always someone on that bottom rung. The idea is just to make sure you're not the one on the bottom rung. It's kind of like the old joke, you're in the woods and a bear starts chasing you. You don't have to run faster than the bear. You just have to run faster than the person that you're with. So with that being said, I mean, it's almost like a little bit of an internal competition in a very positive way. Is, how do you make sure that people aren't on that bottom rung, or, how do you maintain a high performing team? I might have kind of got a little bit off track there, so I'm going to apologize. Did that make any sense?
Yeah, it made sense. We
Okay.
are talking about that also at Mannequin Smith, because we have done some temporary layoffs. But then we talked about, before we start bringing people back as part of the paycheck protection, are we sure we want to bring them back? And a couple of our managers said, well, I thought we had to. I thought if you lay somebody off, you have to bring them back. So it was kind of an education process of, no, we don't have to. This might be a good opportunity to get rid of, like you said, a C player or somebody that's just kind of always been there, because they haven't really done anything terrible, but they're not really the best person either. So I think that's a good point.
All right. Thank you, Rachel. Yes. Well, thank you. That's very kind. Like I said, it's kind of a difficult, discussion to have, but as HR professionals, that's exactly, that's kind of the discussion that we have to at least consider or have from time to time. So I just wanted to throw that out, just kind of a plant the seed. This is also a time, that we may have to evaluate our workforce. All right. So the next one is make it safer to do business as governmental regulations change in the face of the pandemic. So it is more difficult. As a matter of fact, as we mentioned a moment ago, some of us have operations in multiple states. Might be Ohio, it might be Michigan, it might be West Virginia, it could be Pennsylvania. So with that being said, it seems like each state is coming back with its own unique requirements. For example, yesterday I was working on for Pennsylvania Turnpike. For the come back, you've got to have the social distancing. You still have to, wash hands or make sanitizer available if they don't have water nearby. And on a job site, typically they won't. And some of the other aspects, if a person does test positive or has symptoms, they've got to stay away for either 3 days, or if they're positive, 14 days, blah, 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 everything else. But then looking at New York, completely different. And when I say completely, they've got some of the basics, but they say it in a different way, and they want it written in a certain way. So I think that's just a difficult part. It's things that I think most teams, most individuals on the site will follow and understand, but that's a document that we probably have to prepare state by state, share it with those employees, possibly by the supervisor, and then actually have those employees maybe sign off that they've read it, received a copy of it, and agreed to abide by the terms. And then often the client will go ahead and require that signed form that they've received it, and they practice it. So with that being said, it is very difficult when you say streamlining or making it easier. It is safer. I'll just say it that way. Maybe I read easier, but make it safer to do business in government as government regulations change. I think that's what we just have to do. We have to maintain all that. It's kind of like the states starting back up. Each state's going to have a different set of criteria, and we just have to be cognizant of what those criteria are. And what's nice is those clients typically have got maybe a draft or this is what they want to see. But like in my case that I just used going to Pennsylvania, we had what the state provided for us because it wasn't necessarily following federal regulations. The other aspects that we have to consider, but I'm going to get back to that in number 5, is, I'm sorry, in a later topic, is the, how does OSHA work? How does workers' compensation work with that? Because, our responsibility is to the safety and well-being of our employees. So therefore, we can't show them or what I want to say, have them exposed to any kind of a workplace illness or sickness. So that's our responsibilities to go ahead and take that a step if we need to. So sometimes we've got to be a little bit more of a steward or more cognizant of what those federal and state regulations are. Any comment on that? Okay. And hoping it will remain safer. So streamlining processes to help a company do more with less. Shoot, we're in the middle of that right now. I mean, that's all it is. I mean, each of us, it was kind of interesting because we're all in, required businesses or, professional services. So with that being said, I mean, there's a lot of work, and with HR, we have probably got more on our plate now because there's some employees that might be reducing hours. There's other employees that we might be laying off, like we just talked about a moment ago. There's other employees that are transitioning maybe from one department to another department. So we're in the middle of that. And then we also have like the C-suite, the executive suite, and everything else looking at us. Hey, how come our benefits are still costing us an arm and a leg and we've got less people? What's going on? And so on and so forth. So there's a lot more questions. There's a lot more attention on human resources. And even the people I talk to that are not HR, they look at us and think, geez, oh, Pete, you guys must be super busy. And I tell them, yeah, we are. We're very busy right now. We're busier now than we were prior to this. But I think it's important for us to try to track our time that we spend, due to the COVID-19, as well as, some of these additional responsibilities that we have taken under our wings. And, and we become more of a trusted advisor to, like I said, the senior leadership team and everything else. They come to us more often now because of that. Did that make any sense at all? Okay, I heard some nods, so I'm just going to go ahead and keep going. The last thing I have, and I think that was something I'd like to end with in the last 10 minutes, we can discuss how people are preparing for the return to the office. As we said at the beginning of the conversation, that May 1st here in Ohio, the state's opening up again. Well, with that being said, there are going to be, we could in fact go ahead and just say, all right, office is open. Everyone's expected to be in on Monday morning, May 4th, at your work site, ready to go, hit the ground running. We can say that. I don't think that's necessarily all that practical. I think this is going to be probably a little bit more of a phased kind of reentry into the workforce. And the reason I say that is some of the people have multiple monitors, have offices set up at home. They have maybe their work phone at home. They have some monitors at home. They've got their laptop at home and everything else. So it might take a little while, to get everything back in. There's going to be a large number that are going to show up on the office on, Monday the 4th. There's going to be more people that are saying that, what, I've still got kids at home. I still have other aspects. I still have things I've got to do at home. So I want to remain working at home for maybe an additional week or 2 weeks. At that case, we as individuals probably will lean a little bit more towards the senior team just to say, what are they comfortable with? Because this is a little bit of a culture shift. but they also will have to probably go through their supervisor to see, in fact, are they able to continue, or does that supervisor want that employee to come back to that office come May 4th? I think in most cases, the supervisor might be a little lenient and say, yeah, go ahead, take an extra week, take an extra 2 weeks, kind of get all your things in order so that maybe the following Monday or 2 Mondays after, you're actually in the office on a full-time basis, 40 hours, or a slow transition. The other aspect on that, for example, I just used was the people staying at home because maybe they have, children at home that are maybe high school aged, that are not going back in school this year, until maybe sometime or they're not going back to school possibly until fall, if at all. So with that being said, that might be an ability. Also, as I mentioned, that we have a responsibility as human resource professionals to go ahead and keep the health, safety, and welfare of our employees at the forefront. And why I say it that way is, let's take, for example, an employee says, all right, we're opening the office back on May 4th, but that employee does not feel comfortable coming back into the office because he or she may have an underlying condition, maybe diabetes, maybe high blood pressure, maybe they're being treated for heart disease, maybe they possibly even be treated for cancer, anything like that. They may have an underlying ailment. And so I would understand why he or she would not want to come back into the workforce. So something like that, I think what we can do is tap an existing program that we all have in place. It's, family medical leave. Because on the family medical leave form, and that's actually a form created by Department of Labor, you've got where the employee requests that I want to work from home. Well, the work from home is the accommodation, potential accommodation. So they'll say, I want to work from home because I have high blood pressure and diabetes. A second page, I don't know if it's second or third page on it, but that page is filled out by the treating physician. And a physician will go ahead and confirm whether the employee has a, high blood pressure, diabetes, whatever it happens to be. And then a physician will even go so far as to say, yes, I recommend a, work from home until, let's just say it's June 1st or July 1st or whatever it is. It's typically up until their very next time that employee sees that physician. So with that being said, then that could be really come into play, and that would allow us at that time to decide, is working from home a reasonable accommodation or not? So that's our choice at that time as an employer, as a human resource person, to make that decision. What is reasonable, what is not? So let's just go ahead and say, yeah, I think that's a reasonable accommodation. It makes sense. That's what they were doing anyway. So if that's the case, also, and sometimes when we get these contracts and we have to fill that information out, we in fact have to complete, like, hey, have you ever done an accommodation one or affirmative action plan or anything like that? And in this case, as long as we have that, we can say, yes, we did make an accommodation for someone. And here was an accommodation. It might have been a standing desk. It might have been a work from home. It might have been something else. But that's kind of I'm not going to say a win-win necessarily, but at least we, followed a procedure or process that's in place, and we may even get, points for it on a contract or an RFP or something like that. So with that being said, I just threw a lot out there, spewed for a while, and I apologize. Does that make sense at all? Or does anyone have any comment on that?
I'll just reply. This is Stacy again. Just say, yeah, we're working through a transition plan back in. It'll have probably some phasing to it, some rotations. You have people sitting across from each other that we don't, want them in that close proximity. They can't meet the 6-foot requirement. We're looking at, are masks going to be needed? Do we need to plexiglass the reception desk? And yes, what's the procedure for addressing people who desire to work from home for a variety of reasons? One of which just from my own personal side of it, I have anxiety around my children not having access to summer care, and this staying at home aspect of being a parent with your kids continuing. So how do we accommodate that if they don't have childcare for the kids? So I think there's all sorts of different buckets, if you will, and probably a great deal of work involved in trying to figure out how to address them all as we ramp back up.
Agreed. And we're probably going to have as many requests as we have employees that come across. But once again, you do this, because that's state mandated. you're going to have the 6-foot, protective area, and those individual, and maybe masks, definitely a ton of hand sanitizer, which obviously we can't even find right now. And so there's going to be, it is going to be more of a phased return to work. And that's the difficult forecasting part is that phased, is that going to be a 1 month, 2 month, 3 month, 4 month? And really, just like with the COVID-19, we really can't say when that end date is going to be. But then some people at the very end of this may end up working from home full time, and they're able to do it, then great. And if they can't do it, then that's great too. But all of a sudden, that just rises another level of question that comes up: is how come Tommy can work at home and I can't, or however that is. And you just said it's a very real reality is the children at home, and that is a concern of a parent. It's like, well, wait a minute now, that this is not really a good option for me. And so we have to get into what they call the interactive process, which is typically like the the family medical leave, but it is just working back and forth is, kind of defining what exactly is the employee asking for? What is the employee? An example of this was I had an employee that said, you know what, I need a new chair because the lumbar isn't working or anything like that. I had that person fill that family medical leave form out, and the physician wrote back, and it wasn't even close to a chair. It was like a rising desk, or it was something like that. She could not or should not be standing more than 4 hours a day or whatever it was. So sometimes the employees think they know what they need, but you really have to bring in that third party or that trained professional, which in this case is the treating physician, to kind of clarify really what's needed. And a lot of times we as HR professionals even have to look at the employee and say, what's the question? What exactly are you asking for? And many times that's helping the employee walk through the process because he or she might not be 100% clear on what they're asking for because they don't know what the parameters are. And I think that's where we come in as professionals, and that adds value to our organization that we bring to our organization. Okay. Well, I thought it was a good talk. I thought it was good information. I'm looking forward to Holly sending some of this out because that's going to be some good reading. And with that, I see it's the 1:59. So does anyone have any general questions or comments or discussion points that they'd like to maybe hit now or at a future call?
Thank you for the time. I've got to jump off. Thank you.
All right. Well, thank you, everyone. Maybe we'll talk again. So thanks. Be safe, and talk to you soon.
Thank you, Tim.
Bye. Yep. Thanks.